PD transfer set change procedure. Kit components: 10 4x4 gauze sponges, 1 plastic beta cap clamp, 1 white drape, 2 masks, 1 soaking tub, 1 tray. Please note, 2 pairs of sterile gloves are required for this procedure. You will also need to add your disinfectant of choice, 10% Providin iodine solution or 0.55% sodium hypochlorite, also known as Alkavis 50. Recommendations: use strict sterile technique throughout this procedure. Contamination of any portion of the fluid path may result in peritonitis. You may choose to perform a solution exchange and exit site care following the completion of this procedure. Getting ready. Clean the working surface. Wash your hands with an antimicrobial soap. Gather your supplies. You will need a PD transfer set change kit, a new transfer set, your disinfectant of choice, 10% Providone iodine solution or 0.55% sodium hypochlorite solution, also known as Alkavis 50, a new disconnect cap, and 2 pairs of sterile gloves. Performing the procedure. Remove any tape from the patient's transfer set and allow the patient's transfer set to fall freely onto the patient's lap. Open the outer pouch of the transfer set change kit with the label facing up to ensure that the contents remain upright. Remove beta cap clamp package. Open and place the beta cap clamp on the patient's catheter close to the patient's abdomen. Don the mask and then have the patient don his or her mask. Preparing the sterile field. Wash your hands again with antimicrobial soap. Open the sterile wrap of the transfer set change kit, touching only the under corners of the sterile field. Open 1 package of sterile gloves and don 1 sterile glove. With the gloved hand, organize the supplies on the sterile field, leaving at least 4 gauze sponges remaining in the tray. With the non-gloved hand, saturate the gauze sponges located in the tray with disinfectant solution. Fill the soaking tub with approximately 30 milliliters of disinfectant solution. Don the remaining sterile glove. Open the sterile drape and place it on the patient's lap. With one hand, pick up 1 dry gauze sponge. Using the dry gauze sponge, pick up the catheter at the titanium or plastic adapter. Hold the catheter at the titanium or plastic adapter connection. Scrubbing and soaking the catheter. Pick up 1 disinfectant saturated gauze sponge. Hold the titanium or plastic adapter connection with the disinfectant saturated gauze sponge, discarding the dry gauze. Pick up a second disinfectant saturated gauze sponge. Place the titanium or plastic adapter between the 2 disinfectant soaked gauze sponges and scrub the catheter and transfer set connection for 1 to 2 minutes. Disconnect the transfer set from the catheter. Discard the old transfer set. Submerge the open end of the titanium or plastic adapter in the disinfectant solution in the soaking tub. Soak for 5 minutes. Discard all used gauze sponges. Remove gloves while titanium or plastic adapter is soaking. Connecting the open end of the catheter to the sterile transfer set. Open the package of the new sterile transfer set and drop onto the sterile field. Don the second pair of sterile gloves. Close the twist clamp on the new transfer set. Loosen the pull ring on the transfer set on the end that will connect to the patient's catheter. Using a dry, sterile gauze sponge, hold the catheter. Open the soaking tub and lift the catheter from the disinfectant solution. Discard the soaking tub into the tray. Connect the new transfer set to the titanium or plastic adapter. Twist firmly to ensure a tight connection. Open a new mini cap. Replace the tip protector on the new transfer set with the new mini cap. Remove the beta cap clamp, drape, and used supplies. The transfer set change procedure is now complete. You may perform exit site care and a solution exchange per unit policy at this time. Note: when instructing patients in how to use the transfer set, teach them to open the transfer set using only a half turn, stopping when resistance is felt. Twisting more than a half turn may damage the transfer set.